Okay, sister, if you've ever felt dismissed by your healthcare practitioner or just really confused and not getting any help that you needed, or maybe even gaslit when you walked out of that office, this is the episode for you. Tune in to learn why feeling dismissed by your doctor is not in your head, why you may get normal labs from your doctor but still not feel fine, and 4 simple steps to make sure you get the healthcare that you deserve. Let's dive in.
What's up, sister? Welcome back to the Period Whisperer podcast, the show helping perimenopause and menopause women de-stress your body and decode what it's saying to you so you can own your own health, energy, and weight loss again. If you're new, I'm so happy you're here. I'm Bria. I'm your host, a recovering people pleaser and hustle addict turned functional and holistic hormone specialist. Let's lean in and learn what your body is saying to you.
Hey there, sister. Welcome to this exclusive interview episode on the Period Whisperer podcast. So many women today are coming to me in perimenopause. They've been to their healthcare practitioner and told that their blood work is fine when they aren't feeling that way, or they've been dismissed, offered birth control pills and antidepressants. They've been refused hormone testing or hormone replacement therapy. And this has left women suffering and feeling dismissed, gaslit, and even hopeless. I know that was exactly how I felt when I went through that. In this exclusive expert interview with Dr. Jaime Hope, you will get real tips and strategies on how women can best advocate for their health with their healthcare practitioners in perimenopause and always. Dr. Jaime Hope is a dual board certified attending physician, assistant professor, patient advocate, keynote speaker, best-selling author, and passionate educator that helps people navigate the healthcare system to optimize their results. I really wanted to have her on this podcast to share with you some fundamental tips that are going to help you get better help for yourself. You're going to love this and Dr. Jaime. So let's get into it and meet her. Welcome, Dr. Jaime. Well, hey there, amazing Dr. Jaime Hope. Welcome to the Period Whisperer podcast.
Oh my gosh, Bria, I am so excited to be here. I have been a longtime listener and I love the work that you're doing. So I'm really excited to see how I can bring some value to your audience from a physician perspective.
Thank you so much. I love the work that you're doing. So I feel like this is a really great marital connection for us, like just to kind of share some great info across the board. And I really appreciate your time for being here today.
Thank you.
I love that. Okay. So I've already kind of shared a bit of your intro, but you are a dual board certified attending physician, an assistant professor, a keynote speaker, a best-selling author, and an advocator for patient health, which I absolutely love. And you're a mom, which I know. How did you get here?
You know, it's very funny. I back when I was 10 years old, this is such a silly story, but it's actually absolutely true. I'm jumping on a trampoline with my BFF. Mm-hmm. And we're talking the 90s, right, Bria? So there's no net.
No netting.
There's no blue pad around it. It's just rusty springs, right? So and of course we're jumping with this teenager, because why wouldn't you? So the 3 of us are jumping on this like open trampoline. And as the magic happens, the teenager, he hit the trampoline the same time as my bestie and launched her in the air, right? Up and over on the ground. She's immediately screaming. And so I slide across these rusty springs and jump down. And immediately it is clear that her elbow is bent in a way that elbows should not bend. And like what normal people would do, I think would be like also scream or cry or go get her mom. But I'm looking at it and I'm like, what? Like if we could just like get it back to the right way in my head. And she's like, obviously, she's like, no, it's crazy person. Go get my mom. Yeah. I was a 5th grader working on my elbow, but I remember in that moment kind of being like mildly frustrated with myself that I didn't know what to do. Like as if normal 10-year-olds can handle a fracture dislocation.
Amazing story. I love that. Like
I can picture it so clearly in my head. And poor Erica, she turned out fine. She is actually a very fantastic cake artist and she's a radiology tech. So every story has a happy ending. But it made me start wanting to learn more about the body. And so I went to the library, as one did pre-internet, looked the Dewey Decimal System up and started getting some books about just first aid and whatever, because I wanted to be prepared.
Yeah.
And then when I was old enough, I took first aid classes at the Red Cross. And have you ever had a class where the content is good, but the teacher is so bad?
Yes, absolutely.
I mean, I've been in some, not this one in particular, but some other classes that are so bad you consider faking your own death just to get out of it.
Yes. And when you go to college, you just don't go to those classes.
That's much more of a thing now. So I not only did I love the material I was learning, but I was kind of watching the teacher and I was like, I want to teach this.
Yeah.
And so knowing really early on that I wanted to be both a healer and a teacher is kind of scary as a kid. You're like, whoa, that's a lot on first generation college. I had no path laid out for me. And I had so many people discourage me along the way,
Really?
particularly my male instructors. My high school AP calculus teacher told me I wasn't college material.
What?
First of all, I was an AP calculus, but whatever. Throughout my training, I had some male instructors like, oh, you're just here to meet a husband, or, oh, I hate training women. You're just going to quit and go have babies. So people think that this is stuff of the past. It still happens.
Oh my God.
And I see how patients, particularly marginalized groups, are still treated in medicine to this day. So I practice medicine, I see patients, but I couldn't be silent. I can't not advocate for people because I get so passionate about it. So that's kind of how I, jumped off a trampoline and ended up a doctor.
One killer story. Two, I just like, you're so genuine. Like you just took me along that journey. I think everyone listening who's also in our age box is going to fully appreciate the Dewey Decimal System and the rusty trampoline screws.
Yeah.
That's awesome. And I think the world is lucky to have you for sure as a healer and an educator. And I think obviously you do a lot of good in the world, but one of the things that I know you stand for and bring so passionately into the world is that education to help people navigate the healthcare system, like for optimal results, for, probably peace of mind, those kinds of things. I would like to talk about women's health in this case specifically. I mean, obviously that's what we're here on the Period Whisperer, because I know that so many of my sisters listening to us right now in this moment have felt very unheard, very dismissed, very hopeless, which I love that your last name is Hope. It just seems like you're just brain.
Patients ask if it's a fake name. They ask if I really am Dr. Hope. It is my actual last name. I swear.
I love it. Is it your mate? Like, is it your?
It's my maiden name. Yeah.
It's your maiden name. I love that you kept it too. I mean, how can you not, right? That's amazing.
Right.
So yeah, like, what are your thoughts on that? On like how, women getting dismissed, feeling like they're not getting answers in this like massive hormonal transition of perimenopause into menopause?
First of all, I want to validate that this is real. Statistics show that this happens to women. We are statistically less likely to get life-saving interventions, such as a percutaneous catheter intervention, which is a heart cath for a heart attack, even when objectively presenting with similar data. But it's that subjectivity, like, oh, honey, you're just anxious. Whereas if a man comes in with chest pain, they are more likely to get those treatments more often and get them faster. Heart disease is the #1 killer of men and women in the United States and in most developed countries around the world. And so the fact that we have like similar rates of this disease, but are treated different, which your heart has absolutely nothing to do with your gender. It's nonsense. Yeah. And so for women to say, I do feel marginalized, I don't feel listened to, I'm here to validate this is an actual concern. We do our best, like I'm an assistant professor, I teach in the medical school, I'm doing my best to teach. Here's how we listen to people of color. Here is how we listen to women. Here is how we listen to people who don't historically have that voice. But the system is imperfect, and this does still continue to persist. And so we, as women and as patients, also need to learn the steps that we can take so our voice is not ignored.
I love that. I mean, super validating. So thanks for just, holding space for that and helping. I think, even just, this is one of the things I love about friends, like sisters talking to sisters, women talking to women. Like I love when we do open up and share, because you really do start to feel like, oh, I'm not alone in this. This is a valid thought. This is a real thing. So thank you for doing that. I think that's huge. So it sounds to me like there are steps that we can take to begin to, to advocate for ourselves. Is that what you're saying?
Yes. And so the thing is, we're not completely powerless, but it does navigating the system It's complex and it's tricky. It's like understanding the nuances and details of the stock exchange.
Mm-hmm.
You don't just go in there and chuck down some money and hope for the best. I mean, some people do, but that's not a great strategy. And so with the healthcare system, it can be really tricky. And so understanding how you can get the best out of appointments, number one, starts with knowing what is the appropriate site of care for your need. So there's urgent cares, there's ERs, there's primary care doctors, and there's specialists.
Mm-hmm.
So knowing the right place for that is key. Now, I'm not a primary care physician, I'm an ER doc, but I'm a huge advocate of the primary care model. Having that person who knows you, where all the stuff comes to one place, whether they're coordinating with specialists or medications, is incredibly important. Huge shout out to my primary care sister physicians. They work long hours. They often don't get to take a lunch. They're charting, they're answering calls, but they are there for you. However, I'm an emergency doc. So if you're having something like, numbness or weakness in part of your body, chest pain, severe abdominal pain, those things, you need an ER. Why not an urgent care? Because everyone says, well, they're cheaper and faster. Urgent cares are not adequately staffed, trained, or have the equipment to deal with those kind of serious medical problems. So think that might be like a mild urgent care, maybe a mild UTI, a sniffle, cut,
sore throat, ear infection,
sore throat, sometimes even a broken bone if it's not, hanging off, where you're going to need an orthopedic surgeon, right? Sprains, those kind of things, because they are very rarely staffed by board certified physicians. They're often staffed by nurse practitioners and PAs who are trained. They have an excellent place in the medical field, but that training is different.
Mm-hmm.
And some sources they might not even have CAT scan, certainly not the capability to handle strokes, heart attacks, complex abdominal pain, or people who need surgery.
Yeah.
So just kind of getting that idea where to go when something is going on is key. Because I see both ends of the spectrum, right? People coming into the ER with a paper cut, and then they get mad that they have to wait, despite the fact that ERs around the country are so full, it's hard to even explain what it's like right now. Mm-hmm. Or people, and by people I mean women, have symptoms. They're like, oh, my chest is hurting, but I'll just be fine. Let me just continue doing what I'm doing at home, take the kids to something, blah, 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 and kind of neglect their health need. So I really I'm not discouraging people from going in at all. I want to encourage you, if you connect with the right site of care, you're better to get the right care.
Okay. I love that. That's an amazing tip. So first, start with kind of assessing your own symptoms and what is going on inside inside of yourself to know where the most efficient and productive place is for you to begin.
Yes.
And correct me if I'm wrong, because I'm originally Canadian. I live in the US. I know we've got a lot of Canadian and American listeners and listeners from around the world, but
yes,
in Canada, you can't get to a specialist without going to a GP to your
not at all.
care.
Not at all.
In the US here?
It completely depends on your insurance.
Okay.
And there is a benefit to having that. Some people get frustrated viewing it as a gatekeeper. However, often it can be that this is something your primary care physician can handle.
Right.
Or if, say, you're having some heart symptoms like palpitations, maybe they set you up with a cardiologist, but your primary can arrange for that Holter monitor to monitor your beats at home. So when you're going into the cardiologist, you already have data that they can then act on. So this is why you really want your primary care physician involved. They can also help expedite care. I know that this is also true in Canada. There's long waits.
Yes.
That can happen in the US. If you're trying to get a new primary care doctor, say you want to see a new GI doctor, it could be anywhere from 3 to 6 months.
Yeah. Yeah.
So if you want to see a specialist going through your primary care, like what can we do to set you up for success so that by the time you get there, you're ready to get that specialist recommendation.
Right. Okay. I love that. And I love that you talked about data. And that's kind of a perfect segue, I think, into my next question, which is, so I think for the most part, the women listening are, maybe starting to deal with like irregular or really heavy periods. They're feeling tired and exhausted. They're, not sleeping as well as they used to. Maybe they're feeling like they don't have the same bandwidth, not handling stress and emotion the same way. They're in this like magical age box of like 35 to 55, right? We know maybe still having a period. So they know they're not in menopause yet or postmenopausal yet. So I think they're going to their primary care physician. Is that right? Like we're going to our GP?
Yeah, often, or OB, or they're going to their OB/GYN, kind of, so one or the other.
One or the other. Okay. So we know where we're going. But I think a couple things. One, I think women can really relate to this. Like often I'm like finally at a point where I'm so uncomfortable and I'm like, okay, I need to go and talk to someone about this.
That's usually how long we wait. Yes.
Right. Very long till we're at that point. And this is what happened to me. And then you go in and the doctor's like, oh, how are you? You're like, I'm fine.
Of course we're
right away. It's like, we were like, I'm okay. And then if you're having a better day, you can often be like, oh, I'm feeling okay. But in order for us to really like connect with our doctor, get the most of this appointment, because a lot of us are already super busy and then we had to make this appointment, we had to go to the appointment, we got to cover the kids, like whatever we have to do, we get there. What should we be like? What are some things that we should be doing? And I'm wondering if data is one of these things that to go and get the most out of that so we don't leave, or if we are maybe dismissed, that we can stand up for ourselves a little.
Yes. And that is so, so key. So I love data. So I teach, I teach my students, I teach patients. It's the before, during, and after for your doctor's appointment. So before, start gathering data. Because if you come into me or any physician who is going to actually bother to listen and ask you, we're going to ask you kind of this, like the same course of questions. How long has this been going on? Mm-hmm. Has it been constant or coming and going? Mm-hmm. If it's constant, is it going waxing and waning in severity level? Or is that also constant? If it's a pain or a pressure, does it go somewhere else in your body? So if it's in your chest, does it also go to your back or your jaw or your belly? Mm. What makes it better? What makes it worse?
Ooh, I like that. That's a good
right? All of or what doesn't affect it? Because it's very frustrating when you go to a doctor and they say, okay, well, just take Tylenol. And you're like, actually, I've taken it 6 times and there's been no benefit. So what have you tried that has worked? Like, okay, heating pad did help, Tylenol didn't help. So that by the time you're getting there, this is the plan that you have tried. So they have an understanding of what you have done. Now, specifically, if we're talking about these let's continue to normalize these changes we are going to go through if we're privileged to live long enough.
Yeah.
Tracking your symptoms. And now it's so easy. They're the Dewey Decimal System. You don't have to use paper and pen, right?
No more library cards.
And I don't endorse any specific app. I don't own stock in any of them, but pick one. There's a bunch. I don't know, Bria, if there's one you like, but record your symptoms. If you're snapping at your kids for something that's kind of minor that, and believe me, I know it's the straw that broke the camel's back. It's not the first time you asked them to find their darn shoes. It's the 800th time. Mm-hmm. But just even noticing those things, like days like I'm a little crankier than usual with minor stuff. If everyone on the roads is an idiot, maybe your mood is a little bit off.
Yes.
But that's
the common denominator. I'm the problem with me.
Yeah, right? Like I like sing it all the time. But what it is, it's not that you're a terrible person. It's that you are experiencing a hormonal milieu right now, or a lack of sleep, or a lack of energy input in terms of nourishing food and hydration. And so by keeping track and patterns, if you see every day at 3:00, I turn from a nice normal person to like crazy, like psycho mommy, those kind of things are exceptionally important. The problem with a lot of mainstream medicine is, we treat abnormal periods and sometimes post-menopause if people want to be on hormones, but this in-between place is the most likely place you're going to be blown off, where you're going to be told, you're fine, this is normal aging, just deal with it. And if you are keeping track of stuff and you're truly maximizing out your lifestyle stuff, you are getting the restorative sleep, you are getting the nutrition, getting an adequate amount of protein and healthy fat. Women, we need fat in our diet. Oh my God, right? Yeah. We need protein. Yeah. If you're doing all of those and you're still having symptoms, it is perfectly appropriate to have more of an investigation.
Absolutely. I love that you said that, because I think we in society have gotten away from these foundational pillars of health.
Yes.
And we cannot always control sleep, but we can control what happens the hour before we go to sleep. We can control what time we go to sleep, what time we get out of bed at. And there is a foundational amount of sleep that we should be working towards. Likewise with nutrition, you just talked about that. It's like, if you are genuinely eating anti-inflammatory whole foods and you're eating enough to keep you full and satisfied, but we're still having issues. If you are actually trying to manage your stress, if you are actually moving your body. And I always feel like saying to women, like, if you are doing the things consistently and it's not working, we know there's a loss of function somewhere. So that is a very appropriate time to come.
It means something else isn't working, right?
Not working. Yeah. Or if you can't seem to do those things because of whatever else, that's another reason. It's like, there's your flag. Great. This is the time to go. We don't need to question.
Correct. Yeah. If you're like, I'm really not doom scrolling on my phone at night. I am turning off the lights. I'm not eating right before bed. I'm not drinking before bed, and I still can't sleep. Now we need to look at, okay, why? What is going on? Is it, if it's not a lifestyle thing, if it's not you're having caffeine too late, alcohol, other things, is there something wrong? Are you, is there a sleep apnea? Is there a mild sleep disorder? Do you have a thyroid problem? So we don't want to get into a system where we're constantly just patient blaming. Like, right. Oh, you're tired. It's obviously your fault. Because most often, and nobody's perfect, right, Bria? Like, you and I are both very committed to a healthy lifestyle and we love energy. And sometimes we do the exact opposite of what we
100%.
It's a thing. But if I always tell people, like, we need to drop this perfection nonsense.
Yeah.
If the majority of your time you're doing the right thing, and so you're prepared with your data, your changes, your patterns, how long has it been going on? Does it radiate? What makes it better? What makes it worse? What have you tried that's been beneficial? What have you tried that hasn't been beneficial? It speeds up kind of that part of the process. Because, these poor doctors, everyone blames them. They're always running behind and they don't spend much time with you. The way insurance companies in the US work, they basically get like 8 minutes with you. That's all they're paid for.
Yeah.
But they spend more time.
Yeah, absolutely.
And so, but they're not compensated appropriately. It is despicable that in our country that you get paid more to take out the appendix of a teenager than to sit there and have a mental health conversation so that teenager doesn't kill himself. Like, it's horrifying.
Yeah,
right?
that was definitely gave me shivers for sure. And I know certainly from living in Canada, it's just as like in and out, like, 'cause they're just swamped with, and
setting up the last thing, like setting up for success pre-appointment, tell them what you're coming in for. Because if you're like, my back is aching, and then you come in there with like, okay, my back is aching, my hair is falling out, I'm having chest pain. They scheduled you for 8 minutes so they could address your back. If you tell them when you schedule it, I have multiple concerns, then they can give you an appointment for like a more complex visit, which means they're going to block off more time. And there's an expectation that that doctor will be able to address more than one complaint. But if you call them and give them one complaint over the phone, they're going to schedule you for that one complaint. And when they say, okay, you have these other things, I'm really sorry, I need you to schedule a follow-up appointment so we can address those. They're not being a jerk. They're like 50 patients behind, and because the system isn't set up. So let's use the system to our advantage. Yeah. So make that appointment appropriately in the first place so you get the time you deserve with your doctor.
Oh, I love that. I think that's an amazing tip. And you're right. Let's just take a moment to also shout out to the doctors out there, because I think they cannot know everything. They do the best that they can. And I think it sounds to me, and I really feel this way, like we need to make sure we are coming to the table as a part of this relationship with our healthcare practitioner, right?
If we can partner with them, that makes a world of difference in terms of moving forward.
Yeah, I really do feel like we should all know our bodies better than our healthcare practitioners. So we should recognize, and that's what you're saying here, is like, if you do this pre-work where we're not kind of willing, obviously if you're not feeling well, you're not feeling well, we get it, but let's just start to ask ourselves these questions ahead of time. Like, okay, how long has this been going on for? What have I tried? What am I really noticing? Is it cyclical? Is there a pattern here? Like you're saying, then that can really help us, I think, also be clearer when we get into the appointment. Oh, I've just lost your sound.
Yep. Oh, sorry. As if I've never used Zoom before. Like, how long has it been going on? So you're not spending your time like, gosh, did it start before or after Sarah's wedding? And, blah, blah, blah. So if you're getting, of course, this is not emergencies, right? If your thigh bone is broken, we're less concerned about this, but this is primary care.
Yes. We're talking about these hormonal symptoms that we're all having.
Yes. And then having an idea of what your outcome is. If like in the ER, some people come in with a goal of, I want antibiotics. And it's clearly a viral infection. We're going to be at conflict because that is not that's apples and oranges, right? You can't treat a virus with a bacteria.
Yeah.
So if your outcome is like, I want hormone therapy and it's not the right thing, that's fine. But what is the truth outcome you want, right? You want to feel better.
Yeah.
So if that's your outcome, and then there are potential multiple things that can be done to help you feel better, whether it's get connected to, get your hormone levels checked, get connected with a personal trainer, get therapy. I swear, I tell you, the world would be a different place if it was required.
Oh yeah, I'm a huge.
Can we please just normalize that we all need therapy, right?
Yeah. Absolutely. I mean, so we all know we're better with a coach, so let's just do it.
Yes, coaching, all that stuff. And so if your goal is, I want to feel this way, then okay, now how can I've told you my symptoms and what the outcomes I'm looking for. How can we partner to do any potential diagnostics or any treatments that can get me to here?
Yeah.
And as long as that here is realistic, I would also love to look 19 again, but that ship has sailed. Not happening.
That's a different doctor.
Yes, but I want to be the best that I can be for my age. I want to, optimize my health. I also want to do my health protective stuff. So I want to make sure I'm due for a colonoscopy this year. I get my skin checks because I'm super pasty and didn't wear sunblock as a kid because we wore baby oil instead. Woohoo! Who else did that? Thanks for the wrinkles, Grandma. Right? And getting those health protective behaviors done. And Brie, I was talking to you about, so I'm due for some breast imaging. I had an MRI of my breast, just like as a routine care. They found an abnormality that looked kind of suspicious. Then I got an ultrasound. Then I got a biopsy. Thank goodness, benign, right? I know there's a lot of people out there that got a very different answer. So I'm very, very grateful. And then they said, get a follow-up MRI, which I did in 6 months. And then they said, okay, get it in a year. Well, in that time, I have now changed insurances. And so despite the fact that this is recommended and this is what my doctor wants, I'm holding, the sound is my 6-page rejection letter that I don't need it. Clearly, it's not important. Blah, 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 good luck. So knowing, right? And so having that relationship with your physician, now we need to advocate. Now, the secret key is they always tell you, and they have to, why they're rejecting it. So that makes it much easier to frame your appeal. But we can talk about that if we have time.
Yeah.
But so having that relationship, so knowing, I want to be up to date on all my health protective behavior changes. I want to feel this. These are the symptoms I'm noticing. You did your pre-work. You're discussing it with your doctor. And while you're in that visit, don't be afraid to take notes.
Ooh, I like
you
that.
are not going to remember. I am an actual physician, and I was pregnant with my son, and I was having a lot of complications with the pregnancy, which is very scary. I was very emotional. I had an ultrasound. They said something was wrong with his kidneys. Somebody brought out the possibility of intrauterine surgery. Anyway, I get home and I'm a hot mess, like ugly crying, snot everywhere. My husband's like, well, what did they say at the appointment? I'm like, I don't even know. He's like, you're a doctor. I'm like, not today.
Not today.
But if I had somebody with me, or at least written down a few things, I could have got myself together. I had to go back and look at my chart and see what the result was. So it can be overwhelming, especially if there's some bad news or if you're concerned. Like, I want this MRI because I want to know that I don't have cancer. So when we have that level of emotion, having a partner, a friend, a parent, somebody with us and taking notes just helps so you don't forget any of the recommendations and keep you out of the completely emotional brain so you can get what you need.
Yeah. Oh, I love that. That's an amazing tip. So we come really prepared for the appointment. We've let them know all of the things that we're struggling with. And when we're in the appointment, do not hesitate to either bring someone to take notes or take the notes yourself.
Yeah, I'm never offended when patients take notes. Some people want to do they're marking down the second I got in the room and they're already coming in combative because what's your name? And I just recognize that they're having a moment. And I have nothing to hide. So just absolutely, you want to take notes? Here, let me help you. Let me spell that for you so I can ensure that you understand it correctly.
Yes.
And then if you leave a healthcare setting, are we ready to get to that?
Yeah, let's get it. Wow, this is amazing. It's super. Okay, so pre, during, now after. Let's go for it.
So whether this is your doctor's visit or an ER visit or a hospitalization, This is my Hope protocol. I love to name it that because it makes me happy. And I'll give everybody, like, I'll send you a link. You can download this for free, so you don't even have to take notes, because some of you are driving. Please don't take notes. So the Hope protocol. So this is after any healthcare thing. So the H stands for what happened here. What happened here? Did we go over any results? Did we fully cover what do you kind of think is going on? They might not always have a final diagnosis, but any results, any provisional diagnosis, any suspicions.
Yeah.
And then what's next? So that's just like, what happened here? You got to understand that. ER visit, hospitalization, doctor visit. The O is for outpatient. So after you leave this visit, what is going to happen next? What tests are you getting and when? What other healthcare providers are you going to see and when? And do you have that contact info? So really having a clear idea of what the outside plan is going to be to make sure it gets fulfilled. If they say you need to see a cardiologist within 2 weeks because I am concerned that this could potentially be serious, and you call the cardiologist's office and they say they'll get you in 5 months, now you know to advocate because your doctor told you this is your time frame.
Right. I love this.
Right? So what's going to happen when you go outside of this visit? The P is for prescriptions, whether it's supplements or pharmaceuticals.
Okay.
What are you currently on that you should stop or alter? Did anything get changed at this visit? And are they going to put you on any new prescriptions? You should know why. I'm always shocked when patients are like, I don't know, they pull up this like giant like plastic bag of pills. I'm like, okay, so what is the reason you're taking those? And like, I don't know, because the doctor said. And I'm always like that. That's not the only reason. So if you know what you're on and why, that makes a world of difference. If you're on something for stomach acid, you don't need to be on. Those are not intended for life. That's a short-term thing. And so I see people, they've been on it for 5 years and they don't even know why. They're like, oh, I had GERD like years ago.
Oh, yeah.
That affects your digestion, increases your risk for pneumonia, impairs your bone health. So having an app where you keep track of your meds, it can potentially tell you of any interactions.
Yeah.
And really like asking your doctor, like, hey, why am I on this?
Yeah.
And if they're like, I don't think you need it. One of my favorite things is to take people off medication.
Oh, I love that. I love that. This is really great. One, I think you're almost removing some of the decision fatigue for us about like, should I, shouldn't I? It's like, no, we should definitely do this. And then we should do this. So we don't need to be worrying about it. And two, it's almost like these are more questions you want to make sure are answered in the meeting so that you're clear on what am I taking and why.
And yes, and come in with your written questions. I've even done that. Like I've said, I'm a doctor. I'm in my dermatologist office getting my annual skin check, and I forgot my list because, brain fog that day. But then I get home and I'm like, oh no, there was this one spot I wanted them to pay extra attention to, and I got to go back and blah, blah, blah. So bring it with you. Mm-hmm. And then the E for Hope is emergencies. So if you're coming in with any type of symptoms, what would be a sign that this is becoming worse? That you would either need to reschedule an urgent appointment or even go to an emergency department. So knowing those symptoms clearly, what would be red flags, we call them red flags. See, we don't just use those in relationships. Love
that. That's so
Although I've ignored plenty of those too in the past. Now I'm married to an incredible man, but it makes a difference. So what would be some red flags that you would need to seek medical attention sooner? So if you know that's your HOPE, what happened here, what'll happen when you're outside of here, any prescriptions that you're on or that need to be changed in E for what kind of emergency red flag signs and symptoms should you look out for? If you can answer those when you're leaving a healthcare setting, you are completely set up for success.
Oh, I love that. I think that's amazing. Okay. So we've now covered, how to prepare for the meeting, what to do and ask for in the meeting, what to do when we leave the meeting. And then I do want to talk about, especially for our American listeners, like about advocating for, this example you talked about, like where you're being rejected for something through your insurance or payment. But before we do that, what if you go in and you have someone who maybe isn't very responsive, isn't very, doesn't like your questions or really isn't giving you answer, helping you feel, I don't know, what should our expectations or what might our next move be to advocate for our health?
So I even teach my patients red flags and looking for a healthcare provider. It is because it is a relationship. It's an intimate relationship. You're in there in that one size fits nobody gown with your buddy hanging out the back. and trusting this person, right? So if they're getting defensive at what should be considered a routine question, I mean, if you're coming in there and being a combative jerk, then fine. But if you're just like, hey, just out of curiosity, Dr. Smith, why am I on this medication? And they're defensive. That's weird.
Yeah.
Right.
Okay.
That like we're your health partners, we're your advocates. And so while we always want to give the person grace, maybe they're having a hard day, maybe they need to pee, but at the same time, you deserve to ask questions because it is your body. You are paying for this service. It's not a transaction. Like, it's not you're getting a taco at Taco Bell. You can't always get exactly what you want, but that relationship exists. And so sometimes it is the right thing to do to find somebody else.
Mm-hmm.
Sometimes it's just not. I had a physician who knew I was a physician and still treated me like garbage. He was so patronizing, so dismissive. And when he was giving me the risk of the procedures, and I was very clear, these are my values. I would much rather have to have a second procedure than go overboard with the first one and have the complications you're saying. And he's like, haha, oh, honey, you don't have time for that. Did it. Then I had the complication I didn't want. And then when I called, like, hey, I need to come in, I'm having this complication, they're like, you're fine. I was furious. I'm like, oh, absolutely not. And so if they're going to do that to me, you know that they're going to do that to anybody. So I'll absolutely never go back to that person ever again. And so I was like, well, this isn't working. I ignored a few red flags right off the bat.
Yeah.
Because I was like, well, I was busy and he was highly recommended, but you know what? That doesn't always matter.
Yeah. No.
Some of us who are just working clinically, like, I don't have 800 accolades after my name, but the number of lives I've saved is unbelievable. Mm-hmm. Sometimes those accolades come with clinical stuff, like they're doing research or other stuff, which is great. And we love them. But I also love seeing a physician who practices clinical medicine. Yeah. Not just like once in a while in between research. So I just want to give everybody permission. This is something I tell my patients all the time, and I can tell that when they've been blown off before. You've lived in your body your entire life. You will always know it better than anybody else. I'm a specialist in medicine. You are a specialist in you. How can we share our knowledge to help get you an ideal outcome?
Gosh, I love that. That was really beautiful. I think you're right. Like, if we can work on being a specialist in ourselves, which starts with listening to the messages from our body and paying attention to them.
And you're amazing at teaching people that, right? Because we're so good at ignoring. But you and the guest that you have and this consistent message you have is like, yes, let's get back in our body, get into and listen, and don't just say, oh, I'm fine.
Yeah, because it's that piece that helps us advocate better and have a better relationship with the right practitioner at the right place, which I love. Yes. I love that. Okay. So in the example of maybe a woman is coming into her primary care practitioner, and maybe one of her situations is like, yes, I've been having these symptoms for so long. I'm not interested in being on birth control or taking an antidepressant. And, what are my options? And if what we're getting back is there are no options, this is what it is, then that's sort of permission to look elsewhere.
Absolutely. And one thing, so there are, I'm a traditionally trained MD, as traditional as you can get, Big Ten university education, MD. And I remember thinking, even while I was training, hey, we only spoke about nutrition in medical school in service of severe deficiencies, rickets, like things like that, not just or obesity, but not about the malnutrition component of obesity. Yeah. So on my own, I started learning about things like functional medicine. Mm-hmm. And there are other things out there. The problem is the way that many of those providers make money is by selling supplements. Mm-hmm. And so what the traditional mainstream MD community has done is anyone who sells supplements is instantly a quack. And so we dismiss the whole thing instead of parts of it, or just say, okay, if someone is going to give you a recommendation for supplements and they also sell supplements, just consider that. But it doesn't mean that everything is wrong. Mm-hmm. So when patients come in with abdominal pain to the ER and we get a CAT scan and we don't see anything wrong, they always feel frustrated. People are much happier if I tell them they have appendicitis than if they have a normal CAT scan. Yeah. People think it's bizarre, but it's so true because now you have an answer.
Yeah.
But I tell people a CAT scan looks for physical problems.
Yeah.
Is there a physical blockage? Is there an appendicitis? Is there an obstruction? Is there a gallbladder problem? If there's not a physical problem and you are having symptoms, that means it is a functional problem. Your
Functional.
organs aren't functioning the way that they should. Why aren't they propelling? Why aren't you digesting appropriately? And so there are limitations. So utilizing very carefully researched people who are trained in functional medicine. My favorite are people who are also physicians. So they have that education plus the function. And I'm not trying to drum up business. I don't do that. I practice emergency medicine. I learned about functional medicine, but I'm not trying to get customers here. But I actually sincerely mean this as a patient. So when somebody has a more broad type of training, they're more likely to listen to you.
Yeah.
The problem is traditional medicine. We're just looking for disease.
You're looking for something specific.
And we don't pathologize like normal aging as we should. Aging, there's a lot of great books about aging and how we should change our look on it. And so they're like, well, you're not dying. Why are you here?
Mm-hmm. Yeah.
As opposed to saying, here's how we can help you function more optimally. And so if your primary isn't into it, you could consider dropping them or finding a different one, or you could consider adding in somebody who has that kind of training and that's also going to be more willing to listen. The downside is depending on their training. That's another reason I advocate for a doctor who's functional medicine. Your insurance is more likely to cover it. If you go full functional medicine, you're paying cash.
Yeah.
And then the way they make money is selling supplements and selling you functional medicine tests. That's how they get their income. Again, these tests are great, but just use caution.
Yeah. Know your piece kind of thing.
Yeah.
Okay. I love that. That's very, very helpful tips. I think just even clarifying that for people is like, we want to go to our doctor and help rule out those specific problems that we're looking to diagnose. And if it's not physical, then we can lean on, there's a good shot it's functional. What do we do now? And we look for a practitioner that can help us with the functional part.
Because typically it used to be, oh, it's not physical. You're just crazy. Yeah, right. That's what, especially women, like they call it a hysterectomy because we're removing the hysteria. You could just lock your wife up if she disagreed with you or she cried because she's had 5 babies and hasn't ever had an orgasm, and you don't like. Oh my gosh. Like, let's put her in a mental institution. The history of medicine is wild. I did a whole study abroad in that. We could do a whole thing on the history of women's medicine, which would be fascinating.
It would be fascinating. I think we're going to need to schedule that one.
So when I want to say okay, just because it's not physical doesn't mean you're crazy. If it's not physical, it can be functional.
Yes. Yeah. I love that. And it likely is functional, right? Like, I think that's
most of the time.
Yeah, it is. And even if it is somewhere bizarrely, mentally, emotional, that's function. So it's in there. It's in there somewhere.
Because we know our mind has a powerful effect on our body.
Yeah.
It is absolutely proven. I know we're getting up on time, but I do have to make this one point because this is so fascinating. Our body our brain believes what our body tells it. So three quick scenarios. Okay. Number one, so in all 3 scenarios, your heart rate is going fast and your lungs are pumping. All 3 scenarios. Scenario number 1, your brain's like, hey girl, what's going on down there? And you're like, I'm exercising. I'm doing some Zumba. I'm doing my exercise, and your brain's like, oh, that's fantastic. Let me give you some endorphins so you get that good exercise rush. So you keep doing it.
Yeah.
Second scenario, heart's going fast, lungs are going fast. Your brain is like, hey girl, what's going on down there? And you're like, I'm running from a bear or, a wild dog, or trying to catch your garbage truck, or take, whatever in real life. And so your brain's like, oh my gosh, let me flood you with adrenaline so you can get that task. Mm-hmm. Now, unfortunately, your brain can't distinguish between that and, an email inbox that's making you upset. That's a separate issue. Third scenario, heart's going fast, lungs are going fast, and your brain's like, hey there. And you're like, yeah, I'm getting on with my partner here. I'm having a good old time. And your brain's like, yeah, let me flood you with some oxytocin. Mm-hmm. So 3 exact same organ system scenarios with your heart and your lungs, but the way you interpret it, your brain responds with completely different functional responses. Your brain believes what you tell it. And so even when we're saying oh, I am stressed or whatever, I'm just a bad person. No, you're creating a functional response that is happening, and the downstream effects for that. It is powerful and it is real.
I am obsessed with that example. That was incredible. And I will probably use it and credit you several more times in the next couple of weeks. Because
it makes perfect sense, right?
Brilliant. Yeah. And it is true in all forms of our body, isn't it? It's but that's a great example. Thank you. That was amazing. Because I think it's important for anyone listening, especially, when we're paying out of pocket for things. Can you can you give a couple steps around, like, if you get a rejection letter for something that your doctor has recommended that you do, what is that advocation step? Like, what are the things we do there?
Oh my gosh, absolutely. So remember, like physicians, we don't look at our patients as a business. We're like, we went into 6-figure student loan debt to help you.
Yeah.
Insurance companies, it is a business, 100%. And if they reject, X number of people, and it varies per insurance company, and there have been a lot of spicy things in the news lately about insurance executives being murdered and other problems, right? But it's because it's a business. And so if they know that if they reject you, there is a chance you're not going to bother to fight back. So they just saved money. They're not, and everyone's like, well, wouldn't it make more sense to catch my cancer early rather than pay for my downstream chemo? You would think that. But the way people change jobs in insurance is the insurance company is not invested in your long-term health because they have the exact percentage of odds that you're even going to be a customer of theirs in 10 years.
Wow.
So sometimes the rejection is super, super specific. Like, look at women who need Botox in their pelvic floor for pelvic floor pain. Okay, there's no cosmetic benefit. This isn't Botox for migraines, which also secretly gets rid of your crow's feet, that you could see a secondary benefit. Nobody's like, I want my pelvic floor to be less wrinkled. But the insurance company, right? It's stupid. But the insurance company will reject what is a $6 per unit medication because your doctor didn't say the one exact word, even though they got the meaning across. But if they didn't hit that magic secret word, they reject it. So number one, fight back. If this is something that you need. Now for mine, it says my MRI, they rejected. They said, I can consider an alternative test first. Okay, I don't hate the idea of an ultrasound. I'm willing to play the game. And then if the ultrasound says I need an MRI, fine. But I've had a previous abnormal MRI and I want this test so I can compare to see if things are changed. So on my rejection letter, it gives me some specifics, and they are required by law in the US to tell you what your rights are. So then I need to look at this and say, it says right here, appeal process overview, right in this letter, they have to tell you, but it's that secret word or secret thing your insurance company is looking for. If you don't meet the criteria, you can't lie. They can find out. Sometimes you do need to try something alternative first, but if you really believe that you need this, you need to talk to your doctor, write up your thoughts in advance, do a little bit of research, but fight back. Okay. Don't let them save money just because they don't want to pay for your MRI because it's easier to hope that you go away.
Okay. I love that. That's great. So it's like, read the whole letter for sure. Don't take no as like, this is just never, and go back and discuss with your doctor who recommended it to see if we can find that secret word.
Yes. Look for the secret word, consider trying the alternative if it's reasonable. But a good friend of mine has cancer. She sent breast cancer. She sent her tissue for typing, and it gave the typing, like the very super specific testing she got, said, this is the best chemo. It literally objectively said that this is the chemo for you. Her insurance company rejected it and said, you have to try these other 2 chemos first in order to qualify for this expensive chemo. And she's like, but this is nonsense. I'm like, my cancer wants this chemo.
Yeah.
And so the fighting back and forth, and it is exhausting. And at a certain point, if it's something like that, that's potentially life-saving. If your physician's office doesn't have an advocate, and I wish they did, that is an actual role that is out there. So if you are struggling and you contact an advocate, they know a lot more of the secret words than you do. Some of them are disillusioned former insurance company employees, but that can help you navigate and get what you need. So just the key is find out what it is, consider alternatives if appropriate, but like in this case where alternatives were very not appropriate for this very aggressive cancer, fight and don't be afraid to get help.
Yeah, that's amazing. Jaime, thank you so much. This has been like so powerful, so helpful, so tangible, and you deliver it all in such a great way to understand, I think, right? Like you've just taken really complex things and I think made them very, very simple for us. So I really, really appreciate you. Thank you.
Thank you. And thank you for the work that you're doing. Continue to support women and advocate for women because we're all in this together, right?
Yeah, we really are. I think we really are. How and where, and I will put it, of course, in the show notes, but where is the best place for women listening to learn more from you and the work that you do?
If you want to learn more about like how to advocate for yourself as a patient, Family Caregiver Hope Association, it's familycaregiverhope.com. And we'll put that, and I have, free things, red flags, green flags. I'm looking for a doctor. And the Hope protocol that I told you, so I'll send you those links. They're just free. And if anybody is interested in the course, we'll create a coupon code with the name Bria Gadd. So if you are looking for that kind of thing, my favorite thing is to give people discounts, because I think everybody should have access to this information.
Yes, amazing. Thank you so much, Jaime. I will put all of those links in the show notes. Sisters, now you know so much more, and you can go out and be more in your life and not just less on a scale. Thank you, everyone, and we'll catch you in the next episode.
Thank you so much for joining me on the Period Whisperer podcast. If you liked this episode, take 30 seconds right now to write a review on iTunes, and then reach out to me directly on Instagram at Bria_period_whisperer and message me there with a screenshot of your review. As a thank you, I will give you a customized free hormone audit to get you on your way to the best health of your life in midlife.